All right, guys. Why don't we go ahead, in the interest of trying to stay on schedule here, why don't we go ahead and keep moving. So our next speaker is Dr. David Story. He is the clerkship director at Wake Forest, and again, that's where I did my residency training, so I'm pretty familiar with their shop. We actually have one of our interns who's doing a wonderful job, is also from Wake Forest. So we have a good relationship with them. I'm excited to present him. He's going to talk to you about visiting rotations, the 4-week interview. So, and again, keep those questions coming. You guys are doing great.
All right. Good morning, everybody. Is this on? Is this working? Can you? No? How about now? Seems like I'm getting echoed, so probably. All right. Quick response to the bullets that were fired by Dr. Kman to Wake Forest about the lack of fellowships. He's showing his age a little bit. We have many more fellowships now, including critical care, EMS. We're developing a disaster. So please do not disregard Wake Forest based on his comments.
That was 2007, so now you know my age.
All said in jest. Anyways, let's go ahead and get on to what I'm actually here to talk to you guys about. And I'd like to thank the organizers for bringing me in. I'd like to thank you all for coming this morning. We're going to spend the next 15 to 20 minutes talking about away rotations, otherwise known as visiting rotations. But what they really are is a 4-week-long interview. Some objectives of this talk: we're going to be talking about necessity. Not only do you have to do them, that answer is a resounding yes, but how many should you be doing? We're going to talk about the application process. We're going to talk about planning and scheduling these away rotations, how to act when you're on rotation, and then how to leave the rotation as well. My qualifications to give this talk stem, of course, from me being a clerkship director. In this role, I'm in charge of not only the AI at my institution, but I'm in charge of the extramural rotators as well. So I go through, I've gone through hundreds of applications over the course of my tenure as clerkship director at Wake. So that gives me a little bit of insight there. But I think my unique qualifications on this particular topic actually came when I was in your shoes, when I was a medical student. I did my medical school in New Orleans at LSU, and back in 2005, a little storm named Katrina came up and devastated our city. And as such, devastated Charity Hospital, which is where I was doing my training. So I spent the remainder of my 4th year doing away rotation after away rotation after away rotation. So not only do I know the application process very well, I know what it's like to be on aways. So I think that gives me a little bit of a different perspective as well. So let's get right into it. Burning question: do I need to do one? I think anybody you ask within residency faculty sort of picture is going to say yes, you have to do one. This is beneficial to both you and to the people that are going to be evaluating you as a residency applicant in the fall. It allows you to experience a different thing than what you're used to at your home institution. All right? So there are county programs, there are community programs, there are academic programs, and there are differences amongst all of those. Okay? If you have done your training at a purely academic institution, but you're planning on applying to a Jacksonville or a Grady for residency, you probably should find out exactly what you're getting yourself into by spending some time at those institutions before you commit to 3 or 4 years of your training to do so. So having that exposure and being able to get that experience at another type of facility is a benefit to you. You also have inner city or urban EDs versus suburban versus even rural. A lot of difference in practice, in patient population, and the types of trauma you see from all of those different venues. So again, getting to experience something you may not be seeing at your home institution will allow you to have the knowledge to make the best choice for where you would get the best education as a resident. The residency themselves gives you, there's a lot of differences obviously between residencies. They're tightly regulated by the RRC, but as far as the makeup of a residency, it varies a lot. So some residencies are huge with 20 residents per class. 4-year program, you're talking about 80 residents in that class, or in that group of residents. Some are really small, 5 or 6 residents per class in a 3-year program. That's 15 or 18 people within the entire residency. So again, getting a feel for where you feel that you would be most comfortable and be able to get the best education that you can get. Now, I said there's also benefit to the people that are going to be evaluating you, and that comes in the form of the SLO, or the Standardized Letter of Evaluation. Now, I'm not going to go into any details about that because I think we have a discussion on that later today, but let it be known that this is a form which tries to compare apples to apples amongst applicants. So you're obviously going to get one from your home institution, providing that your home institution offers an EM rotation. And then you're also going to get one from your away rotation. Now, the one from the away rotation is being filled out by people who may not have had any preconceived notions about you and didn't know you until you set foot on their campus for a 4-week rotation. So there's a lot of benefit and a lot of information that comes back to the residency directors, the program directors, based on those SLOs. So you need to have a SLO from an away rotation. So of course the follow-up question is, do I need to do 2? This is where I think there's a little bit of variety as far as what answer you're going to get to this question. My personal opinion is that most applicants don't need a second away rotation. There's some caveats to that. Personal preference. Again, if you're doing your training and all of your experiences at a community hospital, but you know you want to go branch out to academics or a county program, perhaps you want to do a month at each type of program to, again, get a feel for what's best for you. So that's where personal preference come in. If there's 2 programs that are at the top of your list and you really have trouble differentiating between the 2, then it might be beneficial to go spend extra time at both, aka an away rotation, to really kind of delineate and hopefully tease out which one of those programs would be your top one. The other side of this coin is, are you trying to compensate for what might be perceived as a weaker application or as a weaker applicant? Say your grades to this point in your clerkships haven't been quite what you expected them to. Your USMLE score wasn't quite as high as you were hoping for. Maybe you had to take a leave of absence and you're trying to, boost your application to kind of explain some of these discrepancies. That might be a good reason for someone to do a second away rotation. Get a second SLO, hopefully of another strong SLO, and that can boost your application a little bit and potentially get your foot in the door a few more places. The benefit of a second rotation, it gets you another interview in essence, right? You have a 4-week audition at every away rotation that you go to. You don't have to impress on paper. You've already done that. You've gotten your foot in the door. Now it's about what you can do at that program. Now, you want to check your school's requirements, potentially based on how you fill out the rest of your 4th year as far as what rotations you're taking. You may or may not have room for a second away rotation. So make sure you're checking that. And of course, the catch-22 here, I already hinted upon. If you're going to get a second away rotation, you're going to need to get a second SLO from that rotation, and you need it to be strong. The last thing you want to do is to do a second away rotation, not be quite as sharp as you were on the first one, and then shoot yourself in the foot with a less than great SLO. So there are risks, there are benefits associated with a second away rotation, and you can certainly talk to faculty and advisors at your institution to see kind of where you fall if you're considering a second. I will say that if you're a very strong applicant, there is almost no reason to do a second away rotation. It's hard to be on, and I'm talking on, 24/7 for 4 weeks in a row. If you try and stretch that out to 8, that's that much more difficult. The application process. There's basically 2 ways to go as far as applying for away rotations. I'd say the majority of the programs out there utilize the VSLO, the Visiting Student Learning Opportunities page, formerly known as VSAS, which was the Visiting Student Application Service. Both are run through the AAMC. You can link it through their website. And this basically provides a central area where you can look up programs, look up what they have to offer, what their requirements are. It's also a central place where you can upload those documents that you need for your application, like your CV, your USMLE scores, letters of recommendation, etc. So it really is kind of a central place, a central hub for you to do all those things. You can highlight what blocks you want, what rotations you want. You can actually receive offers from those programs after you apply, and you can accept or decline them. So it really is very, very central. The alternative version is basically some programs ask you to contact them directly, submit your application materials directly, and they accept you or decline you just based on that interaction, and they do it via email. So when you're looking for away rotations, you need to find out which application style they like doing so that you know where you're going to be submitting your documents. In regards to the process, I would say you need to apply early. If it's through the VSLO or VSAS, there's going to be a date listed on those programs that you're applying to that says this is when we start looking at applications and when we start offering positions within our rotations. So I would say that it's important to try and have your application complete by that date. I will tell you, in full disclosure, that when our date comes at Wake Forest, I pull everybody's application off, all their documents. I sit down with my committee. We go through everybody, and we rank them. And we do that in total for the students that have complete applications at the time that we open. Now, I go back periodically, and I check for people who've updated and who've submitted applications since then, and we plug them in, and we do evaluate those folks, but it gets harder and harder to work them into our master rank list because it gets further and further away from when I've evaluated those initial students. So it does become harder and harder. So I would behoove you to do this early and try and have your ducks in a row and be ready when those dates hit. How many programs should I be applying to? Again, I think you'd see a lot of variety depending on who you asked. My numbers vary. It's a fairly broad number. It's from 4 to 8. I think if you're a really strong applicant, 3 or 4 is all you really need. You're going to get your one away rotation that you need if you're a really strong applicant. If you're a middle-of-the-road applicant, you may need to go 6, 7, 8 deep. Now, there are some things that you can do to increase your chances of matching at those top 6 that you're considering, and that's giving a wide range of acceptable blocks that you'll rotate, and again, being early in the process. You want to make sure you qualify for the programs. So when you look at a program and they tell you these are our requirements, make sure you look closely at the malpractice coverage and make sure that your institution covers enough malpractice for you to go to that place. If they require a letter of recommendation, make sure you get that early. Some require a statement of goals for the rotation. Make sure you personalize it. So do your homework on the place that you're applying to so that when I read your application and I'm looking at the statement of goals, I'm like, okay, this person wants to come to our shop because of this. That makes sense to me, and that's somebody who I think has a genuine interest in our program. When do I rotate? I can tell you that in an ideal world, you rotate at your home institution first, and you follow that up with an away rotation. And you get your away rotation done in the summer months, June, July, August. That way, when ERAS, your residency application service, opens on September 15th-ish, your application is ready with all of your SLOs on board. Okay? Now, I'll tell you in the reality of that, emergency medicine is a growing discipline and specialty choice for students. So more and more people are going in, which means more and more people doing aways, which means more and more people doing aways later into the year. It is not a death sentence to have a late away rotation. September, October, that's okay. Just you want to expedite your SLO as much as possible. But in the ideal world, you're getting it done in the summer months. That's where flexibility comes in and helps you too. If you can give your programs a wide swath of months, like May through August, I am totally fine rotating. That'll increase your chances as well. How do we choose? Well, we look at what you submit. CVs, transcripts, USMLE scores, and we use that and we compare you guys. We don't have the luxury of interviews to get face-to-face and that sort of thing. I look for commitment to the discipline. Have you been involved in your emergency medicine interest group for 3 years? Do you hold any kind of office within that interest group? Have you worked as an EM scribe? Have you volunteered in the ED? Have you worked EMS? Those are all things that tell me that you know what you're getting into with emergency medicine and that you're serious about your choice. Involvement in research, I think most people are not going to make or break you either way on this. If you have it, it's a feather in your cap. If you don't have it, it doesn't hurt you. I don't not take people on an away rotation simply because they don't have any research or publications or anything like that. Use your connections. I think when I was in your shoes, I thought using my connections was cheating. Now I realize it's just the way of the world, and you should 100% use whatever benefit you can to benefit you. All right? This does not mean that you're getting a residency spot. This is just increasing your chances of getting an away rotation. So if you know somebody, resident, faculty at an institution that you're considering, reach out to them. Voice your interest. See if they can put you in touch with the clerkship director to, again, voice that interest. If you don't know anybody at that program, reach out directly to the CD or the PD. Again, voicing your interest and be specific about why you have that interest. At worst, it gets put in the trash bin. At best, you get a second look on your application and potentially move to the top and you get an offer. So I don't think there's any harm in extending that desire or that interest. Okay, you're scheduled. You've got a few things to do before you show up, though. Okay? These are away rotations, which means it's not just down the road from your house most of the time. So reach out to the clerkship coordinator and make sure that there's no documentation that you need to make sure you have. Make sure that, if there's any online training modules that you need to complete, try and have all that stuff done. And by reaching out ahead of time to the coordinator, you can get that stuff done. Check the dress code. Are the scrubs from your home institution fine? Does the institution you're going to provide scrubs? Do I need to wear my white coat? Am I going to a community-based program where most people wear business casual and I'd be out of place if I'm wearing scrubs, so maybe I should be wearing business casual? Ask those questions ahead of time so that you show up with the right outfits. If your schedule allows, show up a day early so that you can go get a little bit of a lay of the land. That way you're not running around getting lost the morning of, and that makes you late to your first orientation. Because obviously that's not the first impression you want to make. So if possible, go to the hospital, go to the emergency department offices before the day of orientation, and see if you can make sure you know where you're going. Schedule requests. It's a reality, right? So inevitably you'll get scheduled for an away rotation, and lo and behold, your sister's getting married that same block. And you need to ask for a couple of days off. That's okay. We don't work you 28 days of a 4-week cycle. So there are days off, and as long as you make requests early that are reasonable, then I don't think that there's any problem with making a few requests. You don't want those requests to be extensive, and you don't want them to be too short a notice. So make sure you're giving them plenty of leadway. During the rotation. All right. You applied, you got your position, you prepared everything before you arrived, and now you're there. You are now forced to be on for the next 28 days, 24/7. It doesn't matter if you're in the department clinically, if you're out socially with residents. Every interaction needs to be treated as if it's part of the interview, because guess what? You're getting analyzed every step of the way. So introduce yourself. Learn other people's names. Treat everybody with respect. This is not just faculty. This is not just residents. These are other students on rotation. This is nursing staff, CNAs, secretaries. Every interaction, I guarantee you, if you have a bad interaction with someone that is a lack of respect on your part, no matter who it is, it's going to get back to the people that care about it. Okay? So treat everybody with respect. Show up early. If your shift starts at 7 a.m., be there at 6:50. Your shift starts at 6:50. Being on time means being late, okay? The last thing you want to do is be strolling in and everybody's already midway through sign out on shift change. That is not a good look, so make sure you're showing up early. Be willing to stay late. If your shift ends at 5 p.m., don't punch the time clock and walk out the door. Make sure your patients are taken care of. Is there a procedure that still needs to be done? Is there an admission call that needs to be made? Is my patient crashing? Those are all reasons that you should not be running out the door. You should be taking care of your patient. We're evaluating that because that's the type of resident that we want to work with, someone who is there to take care of patients primarily. Okay? So make sure that you're coming in early, staying late. I want to clarify roles and expectations. You know, you're going to work with a lot of different residents, a lot of different attendings over the course of a 28-day period. It's not going to be like on wards where you work with the same person for 2 weeks, 3 weeks in a row. So when you come on shift and you're starting a shift, touch base with that attending, with that resident, say, hey, how do you like things done? How do you want today to go? So that you get those expectations early and you're meeting those expectations all the way through the shift. That's going to maximize your potential for success for that shift. Be eager, be enthusiastic, be motivated, be hardworking. Volunteer to do anything. You need someone to clean off the ultrasound machine? No problem, happy to do it. You know, I heard nursing couldn't get an IV in this guy over in room 2. You want me to go try? You want me to pull the ultrasound in there? What can I do to help the team? You want to be asking questions. You want to be voicing your differentials and management plans. You want to do all the things that an acting intern should be doing, okay? You want to be proactive. Offer to see patients without being asked. If EMS rolls into a room and you see them, say, hey, EMS just went into that room. I'm going to go see what's going on. That's awesome. That's the kind of resident that I want too. And then get feedback at the end of the shift. That way your next shift, you can use that feedback to your benefit and be even more impressive the next time. You want to be remembered, but you want to be remembered for the right reasons. So attend all your educational activities, go to all your shifts, you know, actively participate. Don't elbow people out of the way. Don't jump out of your seat or your desk trying to be, you know, overzealous. It's a fine line between, you know, actively participating and being obnoxious, and you don't want to fall on the obnoxious side. If you get an interview offered formally during your rotation, which you certainly might, treat it with formality. Even if you spent 3.5 weeks with these folks, you've got a great rapport, and you feel like this is a time when you could potentially be a little bit laid back because you know them that well, don't fall into that trap. You want to be professional in all of your interactions, and that especially includes an interview if it's offered while you're there. How to leave the rotation. Well, at the end of the rotation, you want to make sure that you're thanking and touching base with the people that allowed this to happen. So stop by the clerkship director's office. Stop by the program director's office. Voice, you know, interest in the program. Stop by the clerkship coordinator's office. And small sidebar, never upset the clerkship coordinator. If you want to get blackballed at a program, that's the easiest way to do it. So extra roses and chocolates for clerkship coordinators. But stop by the office of these folks. Thank them for the opportunity. Thank them for the experience. I think most people don't want or need written thank yous at this point. You don't have to send an email. But if you stop by and tell me, you know, really enjoyed the rotation, I appreciate the opportunity, great. Totally happy with that. And express your interest in the program. Sometimes if you rotate early in the summer, June, it's a good time right around application submission time for you to touch base with the PD again, the program director, and say, hey, just wanted to touch base, again, reiterate my interest in your program and how much I appreciate the opportunity to rotate at your rotation, or at your institution. And, you know, just get your face kind of back into the thought process. And that is essentially visiting rotations in a nutshell. I'm happy to answer any questions that you guys have. Do we have a microphone? Sure.
What if you don't get your first choice for an away rotation? What are some strategies you can use to still make yourself known to the program and still have them get a feel for you if you cannot actually go there?
Well, sending that initial email expressing interest is, I think, a great first step. And it generally, for me at least, it makes me take a second look at an application. You know, if we just happen to be full during the blocks that you're, you know, inquiring about, and that's just the way it is. You know, there's limited spots at each institution. We have 2 per block. That's it at our institution. So not everybody who wants to come can come. But expressing that interest, and I usually, you know, especially if it's a strong applicant, if I get an email like that, I'll forward it to my PD. So when residency application time rolls around, you know, there's a list of folks that we're taking a little closer look at.
One thing I would add to that is there's some institutions that also offer visiting rotations that aren't slow generating rotations. So I know one of my students this year applied to an ultrasound rotation at UC Irvine. It's not going to generate a slow because she's not really going to be working shifts, but it's a good way to get face time with that program. The other thing I'll just say to what you said is many of you will not get your first choice. Away rotations have become very competitive. So, you know, have plans for what happens if you don't, because, you know, if I'm being honest, a lot of people won't get their first choice, but have other programs that you're interested in as well.
There's one other thing that I can add to that. I'm glad we talked about this. I meant to mention it during the talk, but I forgot. If you really have a number one spot that you want to spend 4 weeks at, do it later in the year. So we offer rotations all the way through mid-February before you have to submit your rank list. It, again, will probably not generate a slow because it's so late in the game, but you'll get 4 weeks of face time at a place that you think you really want to go. And guess what? Those late season rotations, no one applies for them. So you stand a much better chance at getting a number one choice, I would say, really late in the game, if you don't get it for when you want to early in the game. But it still gives you that opportunity to spend 4 weeks at a place that you think you're really interested in. We matched one of our top applicants that we matched this current cycle, didn't rotate with us until December, January block. And he made the decision that he really was he wanted that 4 weeks. He wanted to see our program. He came. We really liked him. We meshed well. It was a great fit, and we matched him.
So actually, I see a lot of hands going up. This is a really, I don't want to say controversial, but there's a lot of different viewpoints on the fine points of away rotations. In the interest of getting to our next speaker and staying on the agenda, let me plug lunch again. Are you going to be
I'll be
coming
here
to
for
lunch? So I'm pretty sure every speaker that we have today is coming to lunch. And the goal of lunch is for you to gravitate towards that person that you have a question for. And so there's going to be like 38 people at your lunch table, I think. But, you know, we're all here to answer your questions. And, but we also have speakers that we had to move around because they have other didactics and things to get to. So we'll cut off questions here. We can even do a question and answer part of lunch maybe as well too. So I hate cutting off questions, but I know people might have a session that they have to be at. So let's go ahead and give Dr. Story a round of applause.